Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning into my podcast and for taking this ride with me. If you're new here, welcome. Maybe you're here because you're trying to find your way, discovering your next step towards a non-clinical journey. Maybe you care deeply about impact and you're trying to stop clocking time at work. Maybe you want a sustainable healthcare system for yourself or your loved ones. You're in the right place. This is the place where impact-driven professionals share their journeys and chat about making healthcare safer. Hear how these professionals answer this question. How do we make healthcare safer for our patients and more sustainable for our colleagues?
I can think back to patients that came, into our hospital and came into trauma services in particularly, and were under our team's care, and their families felt uncomfortable. Like they didn't see this as a place of healing. They saw this as a place of stress and anxiety. They saw it as a place that's now generating another medical bill or another bill period that they have no idea how they're going to pay. They see it as a place of reflection where perhaps it's taking them back to even some of their own childhood trauma. I think that while, to your point, seeing some people see the hospital as a place of healing, but others see it through a very different light, which then in my opinion impacts if I see that hospital being accessible to me, right? Am I going to feel judged for the way I show up in that hospital? Or am I going to have some type of penalty that, I just don't need one more thing? It's the reason why in some, cultures, people don't go to the doctor. I remember a whole campaign, I believe it was like with the Tom Joyner Morning Show, but it was like, take your loved ones to work day or take your loved ones to the doctor day. And it was all about getting older adults, and particularly in communities of color, to primary care physicians, because there was just this breakdown in, well, I don't go to the doctor until I am sick. Like I literally am on my last limb here, right? Versus seeing preventative care and having a primary care practitioner that is monitoring you and knows your healthcare, knows your history and your background and is caring for you, and seeing that as preventative care. And I think, again, it's just because of the lens that we see it. So that's where equity comes in as well, right? So it's like we all have access. We all have the ability to go. But the way we perceive that particular hospital or that clinic or what have you also has to do with, do I think that that's accessible to me, right? What are my beliefs about the healthcare system? What are my beliefs about that hospital? How does that going to impact me? Do I take and use gas to drive to the doctor, or do I use that gas to go to work? Do I take the money that I need to go get a prescription, or do I use a home remedy because I need that money to buy groceries? And those are real things that are happening in this country, in communities all around, all around. And I think it's a area that we have to, in my opinion, address systematically. And I think there's some barriers and some silos that have to be broken down between the healthcare system and communities, especially marginalized communities.
Some of the strides that we're making as far as the quality footprint is concerned. So it's now, of course, moved across the entire care continuum. And the performance measures that some are similar, some are a little different, but we still have those cross-setting measures that require all of us to take a look at the same things. And I think that has created some great partnerships, like unheard of partnerships before, whether it's an ACO or any other type of a partnership that you can use quality as the definitive as far as how you're doing. Like I can tell you what I can do for my patients, but I now have data that I can look at and really substantiate what you're saying to me. Okay, you're telling me that you provide great service, but you're a 2.5 star. So I think that has really opened, the door for more, I would say an improvement, the type of care, because I look at stars for everything and I don't buy a 2-star product or a 2.5-star product. So why would I trust the health of myself or my loved one to anything that's 2 and 2.5 stars? So I think that path is going to help as long as we continue. But I think it needs to be ingrained as well in the organization, because if it's only the upper level people who are really the ones that have bought into it, I think it needs to be really, really disseminated. I think at the start, when you hire new people through orientation, it is really about the quality of care that we expect. And there's no compromising on that. And so, yes, we still have a long way to go. We still know that there's still not so great things that happen. There's still harm that occurs to patients. But if we do something about it, if we identify it and do something about it, so now you have a lot more systems and processes in place to capture different types of data. And the focus now can be on how can we fix that.
So how do you think we can make healthcare safer now that you're on the quote unquote other side or on the big picture side? How can we make healthcare safer for our patients and for our frontline team members?
I mean, tough question. There's a lot wrong with healthcare, and it starts in areas that we can't even touch as quality. But I think if we're trying to make a quality movement to improve the patient care experience, then we can't just look at numbers. It's very easy in this role to become a number-focused, number-driven individual. But we have to get back to the basics of what gives rise to those numbers, what drives those numbers, and it's people. So really, if you can motivate, if you can focus, and you can drive a team of clinicians, then the quality measures will follow. They'll go where they need to go. It all comes back to people.
The system itself is just it's definitely broken in terms of communication, in terms of thinking about the patient as a person.
So when thinking about making it safer for patients and in a way that is sustainable as well, and making sure they feel, seen and heard.
I believe that working together, being in that team-based patient care is the real and genuine way to build a sustainable healthcare system that brings joy, because I always have to speak on the joy, to the practicing clinician. And that's what I stand behind in my consulting business, Aligned Care, when I work with collaborating providers. The only way to be sustainable is working together, because when we do work together, we're able to understand each other's pain points. We're able to see how we can come up with a solution, and we're able to be in sync with taking care of our patients.
There's also a lot happening in the regulatory landscape for like social work compact licensure, and some things that make it easier to reduce barriers to access and allow more people access to high quality clinical services, especially people who live in more remote areas where there's fewer services available. And those same things give our workforce choice and more power in negotiation. And so some of those developments make me really hopeful that that will continue to expand, and that I think those things will both help bring good quality healthcare to more people, mental health care to more people, and help empower our workforce to demand better, have higher wages, be more cared for by the organizations they work with.
I think the hard part is that medicine is becoming more corporate and more of a business. I mean, it's always been a business, but it's truly a business now. And that means that doctors, nurses are being pushed more, because if you can squeeze more energy out of a human being, you make more money. The problem with healthcare, it doesn't really operate like pushing people at a fast food restaurant to work faster. There's so many more emotions involved with patient care that if you don't have time to debrief, relax, connect, reflect, grow, learn, like all those human things, then work just becomes very mechanical. And this is a job that is like built upon compassion and communication and connection. And you try to all of a sudden change the mold to where it's very transactional. And it's like, go faster, move faster, push patients through faster. Those are different metrics compared to what the people who go into medicine intending to do, which is connect and offer grace and understanding and, all of that slower building stuff gets washed away. And now it just feels like its own version of a fast food restaurant where you're just pushing people through. And the volume is another thing, which is, I think, that's out of the physician's hands, is out of the nurse's hands. If hospitals are closing locally, which is happening all across the country, those patients have to go somewhere else. And that to me was like the origin of a lot of the crowding, was the closure of primary care clinics, was the closure of local hospitals. And those patients have to go somewhere, and they go to the emergency room. To your question about, is healthcare damaged? I don't remember the exact words you used. Is it about to collapse? I mean, I think we're like at the point where maybe the next 5 or 10 years will really answer that question. I think there are a lot of solutions on their way, like using AI to chart so that you're not stuck at the computer all day. You can be with the patient. I think that is a potential solution that can really shave off a lot of that burnout. And so I'm really curious to see how we fold in technology as a way to sort of become more efficient so that the human isn't pushed too much, but technology is pushed.
But at some degree, you do have to accept that if you do want to work in the system, it is the system. Change can come if we work together, but it will be the system like it is for a while. And so what I've started to do that's helped me tremendously is remember that like this is all about the patient, right? And this is all about them. And sometimes taking ourselves out of the equation is really helpful. And our jobs are so hard and the system sucks so much that oftentimes, it's like, well, physical therapy didn't do this, or they didn't come see the patient. And, oh, well, the nurse didn't give the meds on time. And then the nurse says, no, well, the doctor never put in the order. It's like, I think it's important for us to remember that we can't fight each other. You have to unite, right? Like we cannot, and that's what the insurance companies and the system wants. It wants us to self-destruct and fight each other. But in reality, our common goal is the patient. And so what I've started to do that's helped me with a lot of the annoying stuff about our healthcare system is before I walk into a room, whether it's in the hospital or a clinic, I say, how can I find compassion for this patient? How can I look at this patient and just find compassion for them? How can I get to know them? What is their job? What do they do? Do they have a sister? Do they have a brother? What's important to them? And it's hard because I'm seeing patients back to back every 20 minutes in clinic, but just that like brief thing reminds me that I'm in this for the patient. And, and to them, it can make basically a 5-minute visit feel like a 20-minute visit versus a 20-minute visit feeling like a 5-minute visit, right? And so I think if we do that, I think if we kind of remember that, these people are suffering in front of us and all of our jobs are aimed at helping them, right? That will unite us a little bit more and bring us back to center. So I won't like get mad that the nurse, gave the insulin late or something like that. It's because, they've got their own obstacles too. I wouldn't want to be a nurse. I give all the credit to them. I wouldn't want to be a physical therapist, and people say I wouldn't want to be a doctor. I'm like, well, here we go. We're all saying it in circles. But, I think it's just important to remember that we do this for the patients. That's the most important things. And they're very vulnerable. And we have absolute privilege to be at the position we're in to help them.
It was really eye-opening to see how much could be improved when we started actually looking at what was best for patients and not what was best for one site of care's own billing and what they were concerned about. Really truly taking down silos of care and saying, what's best for patients? How can we figure out how to make this journey a patient is going through, particularly our most complex sick patients? How can we take this journey and make it safer, improve the quality of care, improve the patient's ability to get back home when possible safely, and connect those patients back to their care in the community once they're home?
Catching the mistakes before they reach the patient. That's the hope, which is so important. From a patient safety perspective, we have to get it right. That being said, when you think about things like just culture and, fixing the system, because we know humans aren't perfect, it's kind of an interesting dynamic because, we don't want to blame folks when mistakes are made. We know that the system is the thing we need to fix, yet we have all this burden and pressure on folks to be perfect.
I was seeing, people are sort of spending half of their lives sick. And I think there's a lot of different reasons for that. A lot of them are social and economic, et cetera. Some of it is also that the health system itself is not incentivized to keep people healthy. And I'm not blaming anybody in specific now. Right now, I'm just describing facts as they are. It's incredibly expensive, what we do. I mean, we spend more than twice as much, per person as most other countries that I was just mentioning that are, healthier than we are.
I do believe that safe healthcare begins in academia. I think it begins with the faculty. It begins with the curriculum and students learning what's safe, what's not safe, and providing that information. And I think that starts day one of PT school, when you're in your foundational courses and you're preparing clinicians. I think that is faculty responsibility in the sense of the curriculum to ensure that we are creating a environment where first students feel safe so they can provide, they know what safe feels like, and then they can go out and create safety for our patients, if that makes sense.
I think the biggest challenge is that there's only so many hours in a day and healthcare is run by people. And people aren't machines. And I think it can be really challenging to remember that from both sides. As a healthcare organization, those of us who are seeing healthcare and know the language of healthcare and understand what is routine and what is abnormal or what is sort of on the periphery of the extreme ends of any sort of spectrum. When we see something that is normal, it can be, a normal anomaly, sort of in that range. It can be challenging to remember that for the patient, it's not anything even close to normal, that it's very much scary and unknown, and they feel bad. They physically feel ill at the time. And so remembering all of those things and keeping them top of mind can be a challenge. And then on the flip side, it can be a challenge from the patient perspective to remember that the providers and the staff and the teams are also only human and also have lives outside of the workplace and have other demands and may have family, concerns going on, or may just have a busy life, and that they don't just live and breathe their career, that it is their job, and that it's, it needs to have bounds. And so there isn't a 24/7 ability, like there is, to look something up or buy something on Amazon 24/7. You can't reach your actual physician. They do have to sleep. They do have to, participate in family activities and those sorts of things. So I think it can be difficult on both sides to remember that we're all human, and granting each other that grace is really important.
Anytime we're having conversations that affect client care, patient care, we need to make sure we have the right people in the room. And sometimes that's having some of the people that are actually doing the work in the room and really like valuing their input. I see a lot of people that make decisions from a business aspect. And my motto is you can't grow financially without growing in quality. You can't have one without the other. You may do for a while, with, getting the money, but then your quality is going to suck. And the way that Medicare and the insurance companies work, it's pay for play. You got to have good quality to get good reimbursement. So instead of trying to figure out a way around that, let's figure out a way to actually have good quality.
What they did was they started reorienting the sequence of care within an actual visit. For example, you would do your nurse intake first for your medications. And then for a musculoskeletal patient, then you would have the physical therapist go in. And then you would just have the surgeon come in at the very end to double check and write the prescriptions. And what they were able to find was that not only did their cost of care go down, but their quality outcomes went way, way up, because you were able to ask those specific questions from the person with a deep subject matter expertise in a way that allowed everything to be more time efficient. Because, for example, physical therapists are expert in musculoskeletal care, right? We do this for years, whereas a typical medical training might have a 12-week rotation in musculoskeletal, unless they're an orthopedic surgeon or a sports medicine doctor or something like that, right? And then you have nurses who are deeply, deeply educated in polypharmacy and drug interactions and things like that. And this is just kind of a really unique way to answer your question about how new care models can be created and actually show impact not only financially, but on outcomes.
The biggest mistake I see clinicians make when transitioning away from direct patient care is applying for every available role. Problem is, it's like throwing darts at a board, hoping something sticks. And let's be real, employers can sniff this out like a canine, and it makes the candidate come off as unfocused. The solution, my friend? Do some deep introspective work to identify your passions, skills, and strengths, and find roles that align with that. That's why I've partnered with Career Clinic, who created the healthcare career profile that I wish I had created first. It's called Stream Ahead, and it takes about 10 minutes to complete. It is time well spent to get detailed report of the top work streams that fit who you are. I'll link the assessment in the show notes section of this podcast. And you can use the code BRANDY10, that's BRANDY10 for 10% off. Now let's get back to today's episode. What do you think would make healthcare safer for our patients and more sustainable for our colleagues?
I really think about patient autonomy in the most reasonable ways as a way to be safer. And I've been thinking about this question for a while. You've inspired me from getting to know you, Brandy, about safety. And one thing I see a lot, because I am still so deep in patient care, is how do we better equip people across generations, across cultural differences, across socioeconomic status, that they feel empowered to better speak up, be it about their medication regimen that they don't really feel like they understand and no one's taken time to talk with them, or about a procedure they're about to have. And so if we could only inject everyone with self-efficacy, but there's so many more layers to that. But one of my personal goals is that I would be better at instilling confidence and knowledge to people so that they themselves actually know what's going on with their body. And that allows them to be safer, because I think that's a big gap in our healthcare system.
The hard part is our healthcare system is so confusing. Mm-hmm. And even saying system is a bit of a generous definition of healthcare, right? System implies that things fit together and work together. And I think that's a generous attribute to give to our healthcare system, because it can be so disjointed. I mean, I think that one thing that makes our healthcare system extremely challenging is commercial insurance, and to, somewhat of a political opinion in terms of sometimes the lack of regulation around commercial insurance and what is or is not required. It's very difficult because commercial insurance does not have to reveal how they make decisions, does not have to publicly show what their coverage policies are or when they cover things, how much they pay for things, how they pay for services.
In a lot of places in this country, nurses aren't even making a good living while they're carrying the weight of the world on their shoulders. And that does not have to be that way. I'm really committed to try to reduce the need for hospitals in our society by taking better care of folks. And I believe that the linchpin for doing this, for rescuing primary care, is empowering nurses.
I'll say one of the biggest issues that I see that is still an issue is the disparity between men and women, and especially between Black women and any other group, in all honesty.
Right.
That disparity in research, in advocacy, in legislation has led to issues across the board. It's led to there not being as many folks that look like you and I in the healthcare field as there should be.
Right.
It's led to folks that look like you and I not getting the healthcare in terms of access and quality that they need to have.
Fundamentally, the main reason why we struggle to transform healthcare is the way the healthcare system is paid. And for every hospital and healthcare system, they generate their financial margin on elective surgeries, advanced imaging, and procedures. And so anything that you do that changes the delivery of care that is going to decrease those episodes threatens the financial margin of the system. And we have to remember, hospitals operate on very thin margins. There's not a lot of wiggle room for them.
One of the biggest ways that non-compliance happens is silos. Silos are very much a barrier to being compliant because you have to look at processes end to end. And so the more that an organization teams, I'm a really big fan of Amy Edmondson from Harvard Business School, and she writes a lot about psychological safety as well as has a book called Teaming. And it is that teaming and bringing together those diverse cross-functional skill sets and perspectives that is really critical to doing the right thing.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.